Hello and welcome to the New Indian Express. I'm Chetana Belgare. When the country is yet to recover from the deadly second wave of COVID-19, the unlock process in some of the states like Maharashtra has been slowed down because of the emergence of new variant Delta Plus. Delta Plus has been declared as a variant of concern, and states have been warned by the Central Health Ministry to be vigilant. To understand the epidemiology from India as well as what is happening globally in terms of Delta and Delta Plus variants, we have Dr. Eric Ding, epidemiologist, senior fellow at Federation of American Scientists with us. Dr. Ding, welcome to the New Indian Express. India
Thank you.
reeled under a deadly second wave of the coronavirus, which was caused mainly by the Delta variant of the COVID-19 virus. But now we are already talking about the third wave in India. Do you think India will see another wave?
Well, I think it's hard to say. I think India is still very, very vulnerable. And Delta Plus, we don't know enough about Delta Plus other than it is likely as transmissible as Delta. It's evading certain, monoclonal antibody drugs, but we don't know whether it evades vaccines or not. But obviously, India does not have enough vaccines rolled out, especially 2 doses, because what we know about Delta is very evasive against 1 dose. COVID Shield, aka AstraZeneca vaccine, it's only about 30% efficacious against symptomatic Delta. But there's another study in Scotland that says against total infection, including asymptomatic, it's only about 18% efficacious. And that is very low. Now, with 2 doses, you get 60% with Covishield, AstraZeneca, but still that is not foolproof. And I want to just emphasize that the vaccines do work. 2 doses are definitely better than 1 dose, but obviously India is still very much majority 2 doses and overall still very, very low. So I don't think we're out of the woods. And knowing that Delta Plus has reinfection potential, I think it's really worrisome.
Yeah. So we are seeing Delta variant causing havoc in many countries across the world. Do you think India somewhere lagged, identifying the variant? Was it very late in identifying the variant Delta?
Yeah, I think India does not have the genome sequencing capabilities like the UK has. Very few countries have genome sequencing like the UK. I think that is what allows us to find and know about it much earlier. And although we have identified it months ago, we did not have enough sequencing in order to actually know how much it's growing, not just to find 1 or 2 cases, but how much, what percentage of the population, and how quickly is it growing as a percentage of the population, and does the vaccines work against it? All that requires a lot of sequencing and a lot of people sequenced in order to know these answers. Is it more severe? Right now, we know that Delta is about twice as contagious as the original strains. It is about approximately 4x more greater risk hospitalization, 2.5x greater than Alpha, but 4x greater than the original. And we also know it's obviously 1 dose vaccine, very evasive, and 2 dose, a little bit weaker than before. So I think altogether, Delta is a very, very risky variant. But if you did not have the sequencing to know all this, and we only know this because now Delta has invaded the UK, and UK is able to track down these numbers epidemiologically and genomically, only then can you really respond with adequate and proportional mitigation. But India was in the dark for the longest time.
So how do you think we could speeden up the process of genome sequencing, especially? There's a lot of funding issues and those things which are
Yeah.
kind of holding the INSACOG to do more samples. Yeah. So how do we?
Yeah, I think there should be a rule that, first of all, India needs to do more testing, because in order to do testing, you need to first do testing, then you can do the sequencing. There's also shortcut tests. You can do genotyping as well instead of full genome sequencing, so that you read the full genetic sequence of a whole virus. You can use genotyping, which is a shortcut genetic test for the virus too. But all these require capabilities. You need to develop the genotyping shortcut test, and you need to develop the laboratory capabilities for sequencing or genotyping. And you need to be able to do them fast, because oftentimes some countries the sequencing is 2 weeks to a month behind the actual cases. But you need to be at the forefront. Within 1 week, you need to get the sequencing data of, is Delta growing or not? All that requires infrastructure. All that requires investment from the government into pandemic planning. And of course, the epidemiology to track down these, contact tracing. We know that from Australia that fleeting exposures of just mere seconds can lead to Delta variant. And there's no good enough contact tracing anywhere else in the world other than Australia and New Zealand that can actually pinpoint that it was a fleeting couple second exposure. And so every country has different lessons we can learn from each other, but the core is if a variant arises in your country, and to stop it from spreading to the world and stop it from harming your own citizens, you need to invest in these resources.
So when we're talking about variants, I just wanted to understand, is it necessary that one variant and the lineage of it is always the fitter? I mean, they say that the fitter fits it better. Like, the next variant, is it always going to be a transmissible one? Or is there any, data for that to say that suppose this is Delta and now you have a Delta plus. So yet the transmissibility.
It's not always worse. It's not always worse. Mutations most of the time go in random directions, until there is an evolutionary reason to direct it into a certain direction, such as, birds with longer or shorter beaks have better survival, right? In the Galapagos Island. Those are evolutionary pressures and drivers. And right now, I think we're reaching that point as more people have been previously infected, as fewer people have never been infected. The virus will now search for more evasive of your immune system, evasive of vaccines. That is the general trend because there's very little virgin fields of uninfected people anymore, especially in India, right? And so I think the virus, now that its playground is shrinking, the playground of uninfected people is shrinking, now it's gonna look for ways to high jump and pole vault over those who previously have built some immunity. And that's why I think we're seeing all this. And Delta plus, it's not just another random mutation. It's Delta with a very previously known tricky mutation that is known to be evasive to antibodies. Yeah. So that's why we call it Delta plus as a nickname. It's formerly called Delta AY1, but it's worrisome because it has this extra mutation that is problematic in many other variants that we found.
So how important do you think vaccination will come into play now? Because in India, we are now with several drives happening. We are seeing some kind of pace, but it's way too slow is what we've been noticing. So, and also the efficacy in terms of these variants, there is this whole escaping thing. So how do you see vaccination to play an important role here?
I think vaccinations are important, but they're not the only thing that we can rely on. A country cannot rely on only vaccination as a strategy until the vaccinations are in the 80% or high. And that's the honest truth. We hear a lot about vaccine herd immunity, but that is at a level in which vaccinations are so high, it will prevent the rise of other, and then you can drop masks. But some countries, they say, oh, we're at 30%, or we're at 20%. We're quarter there, or we're a third of the way there. But they think that you have 1/3 the protection of herd immunity. No, what happens is the unvaccinated people have almost no protection, even if you're at 30, 40%. How herd immunity happens is you have almost nothing. And as you get close to 80 or 85%, which is the faster higher threshold for the faster Delta variant, only then as you get super close does it become a vertical line and the herd immunity kicks in. It's not a linear thing. So if you're at 10%, 20%, 30%, your protection is not like this as you approach 80. Your protection is still 0, 0, 0, 0 as you approach 80 in terms of protecting the unvaccinated, to prevent outbreaks among the unvaccinated. And so that is the worry. And again, one dose efficacy against the original strain, one dose was 60, 70% efficacy, pretty good, right? But with the Delta variant, one dose efficacy for infection is 18%, 30% for symptomatic infection. And that's just not high enough. These people are still spreading it. And with 2 doses, AstraZeneca Covishield is 60%, Pfizer is about 83 to 88%, but those numbers are much lower than they were before. And so definitely get this 2 doses, and they will prevent you from being hospitalized, 94% efficacy, but it's not foolproof. And especially since that most of the world is not vaccinated, those who are vaccinated still have to be very, very careful that they're not spreading it. And no country should rely on vaccine-only strategy to mitigate the pandemic, because that strategy does not work until everyone, like 80% or the population, is 2-dose vaccinated. And no country in the world is at that point yet.
This is interesting to know that vaccine alone might not work. So what next? What do we do then? What is the strategies we need to inculcate now to ensure that the pandemic doesn't surge?
Yeah, vaccine alone will work once you get to the 80, 90% level. But until we get to that level, we need masks, especially indoors. We need, avoid public gatherings of large people. We need masks. We need ventilation. Indoors must be ventilated. The ventilation is just as critical as masks because they will dissipate and dilute the air and dilute the aerosols, because this is an airborne virus. So I think those are critical things. There are more expensive solutions like air disinfection machines, like HEPA filters, but obviously many countries cannot afford those things. I think altogether masks and distancing, and we don't want lockdowns. No one wants a lockdown. But if you don't do these other things, you will have to do a lockdown. So it's a small price to pay to wear a mask and ventilate your buildings so that you don't have to do lockdowns. But Delta variant is definitely twice as infectious as other strains. So that's why we have to be super vigilant.
Okay, so now, I just wanted last question, which I wanted to understand is, now that we know that Delta variant is really problematic now. So can this Delta variant, now you have a Delta plus, can this again lineage into a different mutant altogether? Delta itself, the primary variant itself, can it mutate into a different?
Yeah, it could always mutate. There's a reason there's no New Zealand variant, because New Zealand has almost no cases. The saying goes, a virus can't mutate if it can't replicate. And it can't replicate if you don't give it warm bodies, human warm bodies to replicate in. And I think the key is that if we end the epidemic sooner, we'll see fewer variants. But if we don't end this sooner, we'll see more variants that will then cause this greater vaccine efficacy problem. The crisis will keep snowballing, right? But if we are disciplined enough to truly clamp down on cases to low enough levels until the vaccines are there to, have this blanket protection so that we don't have to mask, if we truly have this aggressive approach, then we can end this pandemic sooner. We can end it without, hopefully, the whole world being vaccinated. But right now, it looks like, given how the control in many countries is, that's the worry. And hence, as there are still millions and millions of infections, the virus will still learn to adapt to our bodies and adapt to be more virulent or contagious or evasive against vaccines or host immunity. And I think that is the lesson here. It could learn to be better. There's still lots of evolutionary room for it to become faster, stronger, right? And I think allowing to just spread through the population, let it burn, let it infect everyone, so people develop immunity. Again, that's a very temporary immunity, and it's very dangerous. So any country or leader that tries to advocate for letting it spread through children, letting it spread through population, it's very, very dangerous, not just to people right now, but also dangerous in allowing more variants to arise allowing the pandemic to go even longer.
Thank you, sir. So to sum up, what do you think India should, few steps which if you could sum up, what should India do to ensure that the genome sequencing is speeded up?
Yeah, I think India should build up greater sequencing capabilities. It should definitely have more testing capabilities, more rapid testing, especially, which are not as perfectly accurate as PCR, but allows you to find and rake out as many cases as possible, and then sequence those cases, at least 5% of cases found, and increase infrastructure for contact tracing, masks, and invest in some premium masks. If you mass produce them, premium masks like KN95 or European FFP2 are not that expensive. KN95, KF94, FFP2, they are very feasible. They can be under, $1, under 50 cents per mask on a mass-produced scale. I think that would be much better than cloth masks. Cloth masks work for mitigating some transmission, but not that efficient for inhaling it. And this is a very airborne virus. So I think we need to really upgrade. Doctors need to stop just using surgical masks. I see a lot of Indian hospitals are using surgical masks for their healthcare workers. No, they need to use N95 masks, well-fitted N95 masks. And many hospitals, their healthcare workers are just not doing that. And if we lose healthcare workers, of course, that weakens our healthcare system, and more people will die in the next wave. And I do think there will be another wave. And the Delta variant has taught us a big lesson that we thought it was over, right? Many wealthy countries thought it was over. It is not. And India thought it was over. It is not. There will be more waves, and they may be smaller. And hopefully there will be much, much smaller if we do all these mitigations. But I think we need masks, premium masks, infrastructure, contact tracing, ventilation, and I think increasing all of these precautions will prevent lockdowns and allow us to exit the pandemic sooner.
Thank you for joining us, Dr. Ding. It was a pleasure talking to you. So people, now we know that just vaccination or just vaccinating ourselves is not really enough. We need to do more. That means we have to wear our masks, maintain distance, and ensure that we beat the virus. Thank you for watching the New Indian Express. We'll be back soon.